Hey, well, good evening, everyone. Thank you so much for joining us. My name is Mike McGuire, and I'm honored to be able to work with you as state senator, representing the beautiful North Bay and North Coast between the Oregon border and the Golden Gate Bridge. We are so thankful that you have taken time out of your busy schedule this evening to be able to attend this critical town hall, focused on slowing the spread and a special focus on vaccine distribution throughout the state and an eye towards Northern California. We have a couple of thousand folks who are tuning in tonight from all across Northern California. And again, we welcome you for this evening's critical forum. We promise to be able to answer as many questions as possible. I will be candid. We have over 3,000 questions that have been submitted. We're going to try to get through as many as possible. And of course, we welcome any additional comments or questions this evening. Senator.McGuire@senate.ca.gov. If you're watching right now, feel free to submit your question, your comment, senator.mcguire@senate.ca.gov. Tonight, we're coming together to be able to discuss slowing the spread of the coronavirus. And again, we're going to have that special focus on distributing the vaccine. Now, for the first time since the beginning of the pandemic, I can finally say that there is a light at the end of the tunnel. But we have to remain vigilant, all of us, to ensure that light continues to burn bright. So let's talk about expanding vaccine distribution here on the North Coast, the timeline, and how it's all going to work. Longer term, the outlook for vaccines looks incredibly promising. I say that as a person who believes in under-promising and over-delivering. The federal government is now asking the state of California in all regions, in rural counties and urban, to prepare for 4 million vaccines per week. We've been meeting with all counties on the North Coast and the North Bay every other week. Public health officers, county administrators, the directors of health and human services, ensuring that each of their individual vaccination expansion plans will be submitted on time to the state of California by the end of March. Now, this plan, among other critical details, will be focused on developing the network needed to greatly expand vaccination operations starting in approximately May and into June. So we're looking at a significant expansion of vaccine distribution plans starting in May and into June. Now, the shorter term forecast with vaccinations, it does not look as robust, and we always want to be upfront with you. The next 3-week forecast coming from the federal government into the state of California, it's going to remain fairly flat. The week of March 24th, we are expecting a little over about 1.8 million vaccines due to the state from the federal government. The week of March 28th, we're looking at a little over 1.8 million. The week of April 4th, again, a little over 1.8 million vaccines coming to the state from the federal government. Now, the allocations that I just mentioned, they don't include the direct allocations from the federal government that's going to Walgreens and CVS pharmacies. Those two pharmacies have individual direct contracts with the federal government, and they get their own separate allocation. In addition, some federally qualified health centers and FEMA vaccination sites, they also get their own separate allocation of vaccines on top of what the state is receiving each week. So the actual number of doses of vaccine coming into the state of California is higher than that 1.8 million that I stated above. That 1.8 million simply represents what the federal government is sending us directly as a state. Now, let's talk about some good news. Number one, about half of all Californians age 65 and up, they have now received at least one dose of vaccine. The second bit of good news, the last 48-hour period here in the Golden State, well, it was the highest for shots into arms since vaccine distribution started. Just over 1 million doses of vaccine were allocated here in the state of California. That's some really good news. Number three, as we look back and we look forward, it took approximately 2.5 months to get to 10 million doses of vaccine into arms between December of 2020 and early March. 2.5 months, 10 million vaccinations. In the two-week period here in March, we have now already put 3 million doses into arms. So we're greatly expanding the pace in which vaccines are getting to individuals. Really good news. And I always want to be honest and talk straight. Are things improving? Yes. Should we be satisfied? Absolutely not. We know that we must do better. And I can promise you we will. Folks have a right to be frustrated. The vaccine rollout has been less than smooth on the federal and state side. And I promise you, and I don't take this lightly, positive changes, they are coming. But we still have a lot of work in front of us, which is why we want to be able to get into this town hall here tonight. Tonight, we have a big event planned for you. First, we're going to hear from Dr. Brewer. Dr. Brewer has been with us since the beginning of the pandemic. He is one of the best infectious disease physicians in America. He is from UCLA Geffen School of Medicine. He's going to be talking all issues of COVID-19. We are also so excited that Lori Nazura is back. Lori Nazura is the Deputy Director for the Office of Emergency Services in the state of California. She's going to be focusing on vaccine distribution in the Golden State. Lori also serves as the co-chair of California's COVID-19 Vaccine Task Force. Now, the most important part of this evening, it's having a conversation with all of you. Again, we've literally received thousands of questions here tonight. We have over 2,000 folks who are joining us now, and now it's about 2,700. If you'd like to be able to join the conversation tonight, if you're watching via video live stream or on the phone, email us, senator.mcguire@senate.ca.gov. If you're watching right now on Facebook, simply drop your question, your comment into the chat section there, the comment section on Facebook, and we'll get to your questions and comments. All right, so here we go. Let's start talking about the coronavirus and where we're at as a state. We're going to turn the town hall over to Dr. Brewer. He's going to give us an overview about the statistics of the coronavirus here in California. He's going to tell us if he's concerned about a potential third wave of the virus in the state, like Europe is starting to see. He will also talk about when we can start letting our guard down. When is it that we're going to see that herd immunity of 85%? He's going to cover how life will change and maybe not so much when you're fully vaccinated. He's also going to be talking about the 3 approved vaccines and how they're going to be able to push back on the various variants that we're seeing across the world. So ladies and gentlemen, let's turn it over now to Dr. Brewer for his status briefing. Dr. Brewer, good evening and welcome. The floor is yours.
Thank you very much, Senator McGuire, and thank you again for allowing me to share this opportunity to be with you and talk a little bit about the COVID-19 pandemic and the SARS-CoV-2 virus. So let's start with where we are. So in the world right now, we're having about 400,000 to 500,000 cases of SARS-CoV-2 infection a day. To put that in perspective, that's about half of what we were having at the beginning of January. So the good news is we're way down from where we were at the peak. The challenging part is that number has stayed flat since about the middle of February, and actually it's been creeping up a little bit. And if you look around the world, it's a little more complicated than that. So the senator mentioned Europe. So in Europe, in the United Kingdom and Spain, their numbers are actually dropping. Their case numbers are dropping and have continued to drop since the middle of January. Whereas in France and Germany, and particularly in Italy, they're actually starting to go up. And Italy is actually probably going into another surge right now with about 20 to 25,000 cases a day. Here in the United States, it's a similar picture. So in the US right now, we're averaging about 50 to 60,000 cases of COVID-19 a day. Again, well down from the 240 to 250,000 cases we were seeing per day at the beginning of January. So a tremendous improvement. But that having been said, we've been kind of flat for about the last week or two, and it really hasn't been going down. And if you look around the country, you see places like Michigan and Alabama and New Jersey, their case numbers are actually starting to creep up again. Fortunately, here in California, Florida, Texas, our numbers are still going down. So where are we in California? California, we're at about 2,000 to 3,000 cases a day, down from about 40,000 cases a day. So tremendous improvement. And our test positivity rate is running about 2%. And at least in Los Angeles County, that was up around 20% at the peak. So again, we're doing much better than we were 2 short months ago. That having been said, in the northern counties like Humboldt County, you're running at about 2.9%, Sonoma County about 2.4% test positivity. So while you're better off than you were in January, you are lagging a little bit behind the rest of the state. So we still need to be aware that coronavirus is in our communities and doing all those things like wearing our masks, washing our hands, maintaining our physical distancing, which have been so important to get us where we are today. The senator mentioned that we have vaccines, and since we last met, we actually have a new vaccine on the scene, the Johnson & Johnson vaccine. So we now have 3 approved vaccines available to us, 2 that are mRNA-based vaccines, 1 is an adenovirus-based vaccine. But for purposes of this discussion, you can really think of them as interchangeable. You may have heard that the Pfizer and Moderna vaccines are 94 to 95% effective, and the Johnson & Johnson is only 66% effective. Well, the problem is you can't really compare these vaccines that way because these trials were done in different locations. For example, the Johnson & Johnson vaccine included studies in Brazil and South Africa, and we'll talk about why that's important in a minute. But secondly, if you look at serious disease, hospitalization, and deaths, all of these vaccines are highly effective against preventing those terrible outcomes. So the important thing is, if you're eligible to get a vaccine, please do go get vaccinated, regardless of which vaccine it is. And if you have any concerns about whether or not one vaccine is more appropriate for you than another, talk with your healthcare provider. The other key take-home message for the vaccines is you cannot get COVID-19 from these vaccines. So these vaccines do not cause disease. They cause side effects. You'll get a sore arm. You might have some muscle ache, but you cannot get COVID-19 disease from any of these 3 vaccines. So let's say you're lucky enough to have been vaccinated. What can you do now that you couldn't do before? So one of the things you can do is you can get together with other people who've been fully vaccinated. And by fully vaccinated, we mean it's been at least 2 weeks since your last dose. So if you got Pfizer or Moderna, it's 2 weeks after your second dose. If you got the Johnson & Johnson, it's 2 weeks after the 1 dose, because that's a 1-dose vaccine. So if you're fully vaccinated, you can now get together with other people who are fully vaccinated. You don't have to wear a mask indoors. You can also get together with people in a single household as long as no one there is at high risk for having COVID-19 disease without wearing a mask, which means that if you want to visit your grandchildren and you've been vaccinated and nobody in the house is at high risk for having serious COVID disease, you can visit them without wearing a mask. So that's a big change. What stays the same? Even if you've been fully vaccinated, you still have to wear a mask when you go out in public, you go to the store, you still want to practice your physical distancing, you still want to do that good hand hygiene, and you still want to stay home if you're sick. Finally, we're just going to briefly talk about variants, and we can get into this when we get into the discussion. So SARS-CoV-2 is an RNA virus. It makes mistakes when it replicates. We call those mutations. Most of those times, these mutations have no effect on the virus, but sometimes they can make the virus more easy to spread or make the virus more deadly. When that happens, we call them a new variant or strain. Right now, there are 5 variants of concern that the CDC is tracking. United Kingdom, Brazil, South Africa, and 2 in California. And by variants of concern, the CDC means there's something about these viruses that's worrisome. And what we know is all 5 of these viruses are easier to transmit than the other COVID-19 virus that had been circulating. And in fact, we suspect that the UK virus will probably become the dominant virus across the United States over the course of the next several months. The other concerning feature of the Brazil virus, the South Africa virus, and potentially the California viruses is the vaccines may be a little less effective against them. But looking at the data so far, the level of protection from the vaccines is probably still high enough to prevent serious disease, hospitalizations, and deaths against these viruses. And the vaccines seem to work just as well against the UK virus as the other. So I'm going to stop there, and I'm looking forward to answering your questions. And thank you again for allowing me to be here.
Dr. Brewer, you have been the steady hand, the steady voice of reason as we've gone through this pandemic together over these past many months. We can't thank you enough. Dr. Brewer is a tremendous infectious disease physician. He also makes his rounds at the hospital, and we truly appreciate your service, sir, now more than ever. And thank you for joining us. Ladies and gentlemen, we are now going to transition to talk about vaccine distribution. And there's no one better to talk about that than Lori Nazura. Lori is a deputy director at the State Office of Emergency Services, but she also serves a very critical role as the co-chair of the COVID-19 vaccine task force here in the Golden State. She's going to update us on all issues of vaccine distribution. She's going to be talking about Blue Shield and why an organization like Blue Shield is going to be handling the vaccine distribution, managing the vaccine distribution for the state of California. We're going to talk about eligibility criteria. We're getting a lot of questions about who's eligible and who's not. We're going to talk about vaccine equity here in just a bit. And then also, what is the strategy that the state has to be able to expand capacity to get more folks vaccinated? You have questions? Ms. Nazura has answers. So let's turn it over to the Deputy Director and the co-chair of California's Vaccine Task Force. Madam Deputy Director, we are grateful for your work and welcome to the Town Hall. The floor is yours.
Thank you, Senator. Thank you again for inviting me. It's a privilege to be here with you and Dr. Brewer to talk to your constituents. And these topics today that Senator McGuire has asked me to cover are areas that maybe have been a little confusing to you. So hopefully I'll be able to shed a little light, and through the question and answers, we can really drill down to some of the details. I was going to start off talking about vaccine supply, but Senator McGuire obviously got hold of my talking points, so he covered that, that area. I'm just going to say that we have to continue doing a good job as a state to spend down our vaccine inventory in order to maximize our vaccine allocations. Right now, our current network can vaccinate about 3 million people per week if all the sites that are currently in the network are opened up to maximum capacity. Now, the number one issue, of course, that we all know is vaccine supply. But let's talk about where we want to be when that is no longer an issue. And that's really when we start talking about the third-party administrator, Blue Shield. They're working hard to ensure that all across the state, we're putting infrastructure in place so that when that vaccine does increase, we can put it in arms right away. And they're doing this through several different avenues of effort. One is creating a statewide network of providers. The other is citing geographically diverse mega sites. They're also bringing on additional mobile providers. They're creating a plan for vaccinating the homebound. And they're ensuring as many pharmacies, chains, both chain and independent, are providing vaccinations. So I'm going to take each of those separately to begin with. Let's talk about creating a state network of providers. So California is a home rule state. And prior to the TPA, we had these disparate competing efforts going on in the state. We had counties, healthcare systems, independent healthcare providers, pharmacies, clinics, et cetera, on different databases and systems that didn't talk to each other. So we had no statewide picture on the vaccine efforts. Early on, everyone was claiming, hey, where's the data that shows how we're doing? And the reason we didn't have it was because we didn't have that statewide system. Even data as simple as how many vaccines were administered in a given day wasn't available because we couldn't see what everybody was doing. So the TPA is putting everyone on a single system. Senator McGuire's already talked about it. It's my turn. For the first time, we can clearly see where the gaps are and where we, as a state, need to move resources and even target the vaccine allocations. And I'm going to talk about that in a moment. And then as far as mega sites, they have their value. For example, Senator McGuire mentioned the Cal-OES FEMA mega sites in Oakland and East Los Angeles. We can vaccinate between 6,000 to 7,000 people per day at each of those sites. Dodger Stadium can vaccinate up to 8,000 per day. Moscone Center can do about 4,000 per day. We need to ensure that we have these types of vaccination centers peppered throughout the state. But not everybody wants to go or is able to get to a mega site. So for them, mobile or what we call pop-up vaccination clinics are preferable. So the TPA is working on providing that. This is not a resource every county can afford. So the state has entered into contracts with two companies, Color and OptumServe, to do mobile clinics. OptumServe may sound familiar to you. I know you have some up in your district, Senator McGuire. They were brought on early in the pandemic to do mobile COVID-19 testing, and now they're just transitioning those same units and sites to do vaccinations. Counties can enter into agreements with the state for these units. Then a significant issue that has not yet been, we've not yet broken the ground on this, but that's creating a plan for vaccinating the homebound. Some individuals can't get out to a mobile unit or a mega site. They can't get out to a provider. They need someone to come to their home. So the TPA is working with counties to develop a program to do just that. And then finally, as far as pharmacies are concerned, they're in every community. They annually conduct flu vaccinations. They're trusted. The TPA is looking to see how many, getting as many as possible to join the network. So in addition to developing the infrastructure for large-scale coordinated vaccination operations, the TPA is focused on ensuring equity. They're creating a network designed to reach the most vulnerable and those disproportionately affected by COVID-19 infection and death. They're supporting providers and local health jurisdictions for FEMA-eligible costs associated with supporting the transition to a new system and workflow. And I don't know if everyone's familiar with that. The FEMA is picking up very, very large portion of vaccine costs as part of their disaster assistance program. So that's really good news for the state of California. Another thing that the TPA is doing is developing a patient navigators program. And that's going to help counties help the individuals in their jurisdictions to find those resources available to them. And then they also are providing support services, extended hours, language capacity, accommodations for physical accessibility, and like I said before, more mobile clinics. So vaccine equity in California has been talked about a lot. We know 40% of COVID cases and deaths have occurred in the lowest quartile of the Healthy Places Index, that's HPI. And that provides overall scores and data that predict life expectancy and compares community conditions that shape health across the state. We know that the rate of infections for households making less than $40,000 per year is more than double that of households with an income of $120,000 or more. At the same time, California's wealthiest populations are being vaccinated at nearly twice the rate of our most vulnerable populations. So the state has to do better. And this is where the TPA is going to come in by changing the vaccine allocation formula. They're going to start with the HPI, which reflects 25 community characteristics using data related to things like economy, education, healthcare access, housing, neighborhoods, clean environment, transportation, and social environment. Then they take the California's 1,650 plus zip codes and divide them into 4 quarters based on the HPI index. And then those with the highest HPI correlate to better health outcomes. Those with lower scores are the first quartile, and they reflect the worst health outcomes. So starting last week, first doses will be allocated based on 2 steps. One is by looking at the eligible population, and we'll talk about eligibility criteria.
30 seconds, Deputy Director, I apologize.
No problem. So they're going to take the eligible population, divide it 70, and they're going to give a double allocation to the lowest HPI quartile. So that means that 40% of that vaccine allocation will go to those most in need. Now, I did want to talk just finally about the current eligibility criteria. You're familiar that with phase 1A, healthcare workers and long-term care residents and staff, and phase 1B, we have been in that for over a month now. That's food and agricultural workers, education and childcare, and emergency services, and those who are 65 plus. So beginning this past Monday, March 15th, healthcare providers may use their clinical judgment to vaccinate individuals who are 16 to 64 years of age and deemed to be in the very highest risk for morbidity and mortality from COVID-19 as a direct result of one or more of the severe health conditions. We've got all that information on the website. You can go and look and see what those health conditions are. It's important for folks to know that this is going to be a self-attestation. You do not need to get a note from your doctor and take it to the pharmacy to get vaccinated. Also, this last week, guidance came out from the Department of Public Health to include individuals who reside in high-risk congregate settings, such as the homeless, and public transit workers are now included. Janitors are included. Education and childcare was clarified so that those who are informal childcare workers, like if you take care of your grandkids, those in foster care, providing foster care homes, those in children's residential community care facilities, and even library staff. And then emergency services was clarified to include utility workers and disaster service workers and social workers. So I'll stop there. I'm open for questions. Hopefully that was a little bit of a taste of the value in having the third-party administrator here in the state of California to help us create the network to move us to more vaccinations as soon as that supply increases.
Thank you so much. That's Lori Nazura. She's the co-chair of California's COVID-19 Vaccine Task Force, also Deputy Director at the California Office of Emergency Services. All right, so let's get into it, the most important part of tonight, and that is focus on your questions, your comments, and they are coming in hot and heavy. I want to just repeat, all North Coast counties, from Del Norte in the north, Marin County in the south, we're working with each and every one of them to be able to get their vaccine expansion plan, their distribution plan, written, submitted to the state by the end of March. We are preparing as a state to look at 4 million vaccines per week coming from the feds to the state sometime in May into June in perpetuity until we're able to tackle this pandemic. So good news is on the horizon. The next 3 weeks, our allocation is fairly flat. But again, we're preparing for a significant uptick of vaccines, which means we're working hard to develop the backbone of that new and expanded distribution network. So let's get to your questions right now. If you have questions on vaccine distribution, eligibility, the various variants that are out there, Dr. Brewer, Lori Nazura, have your answers. Senator.McGuire at senate.ca.gov. Email us right now, questions and comments, senator.mcguire at senate.ca.gov. If you're watching on Facebook, simply leave a comment, a question in the comment section. We'll make sure and get it over to Dr. Brewer or Lori Nazura. Here we go. Let's jump in right now. This first question is coming in from Matthew. Matthew, Dr. Brewer asks, how long does the COVID vaccine last? And after that period, how many doses are required for additional vaccination. So, Dr. Brewer, are we going to get this damn thing like we do our flu shot every year? What do you see as far as the vaccination shot going forward here in California and the rest of America?
So Matthew, at least so far, there's no evidence to suggest that any waning immunity from the vaccine. So remember, we only have data for about 8 months, but that protection seems to last for that entire 8 months. And one of the things that we're learning is how long will that protection last for? So I can't answer the question yet as to whether or not you'll have to get a booster, but so far, the protection seems to last for as long as we've measured it for.
So, Dr. Brewer, annual basis, do you believe this is going to be like a flu shot that we're going to have to get every year?
So it's totally going to depend on 2 factors. One factor is how long does that immune response last? And the second is how much does the virus change? So the reason why you have to get a flu shot every year is the flu virus actually changes a lot as it replicates. It actually changes more than coronaviruses do. So it makes more mistakes, it changes faster. That's why you need a flu shot every year. If we can slow down the transmission of the SARS-CoV-2 virus, keep those variants from emerging, we may not have to get a vaccine every year.
And so, Dr. Brewer, let's expand on that. I want to get your gut check. 2022 is here. I got my Moderna. I have gotten a shot, by the way. I'm being hypothetical. I'm waiting my turn. So, but if I were to receive my shot in March, do you anticipate that I'm going to have to get another shot in 2022?
So based on what we know right now, Senator, the answer is no. So I got my Pfizer vaccine in December and early January. And at least the data suggests that even with the new variants from Brazil and South Africa, I'm still protected against serious disease, hospitalization, and death. So as long as that immunity holds up and the virus doesn't change, for the moment, I'm good.
All right. So now Maureen writes in, we are getting a slew of questions, and thank you. Send your questions to senator.mcguire@senate.ca.gov. Maureen asks, how long after my second shot can I quit wearing my mask?
So Maureen, it depends on where you're going. So if you're going to the supermarket, you still have to wear your mask. I'm sorry about that. But going out in public, wear your mask, keep your physical distancing, don't go out if you've been sick, even if you've been vaccinated. However, Maureen, you can go visit your grandchildren, if you have grandchildren. You can go visit one other household where no one is at high risk for getting severe COVID disease without wearing a mask. You can also get together with other people who have been fully vaccinated without wearing a mask. And by fully vaccinated, remember, we mean 2 weeks after the second dose if you got Pfizer or Moderna, or 2 weeks after Johnson & Johnson, because that's a 1-dose vaccine.
So we're going to go to Deputy Director Nazur in just a moment, but let's talk about the 3 vaccines that are on the market, Johnson & Johnson, Pfizer, and Moderna. A lot of questions about which one of those 3 are more effective. You mentioned this in your opening statement, and I'm just going to be candid. We're getting a lot of questions about the success rate for Johnson & Johnson. So talk to us about that. Should folks be, if they can, requesting one of the manufacturers over another? Do they all have the same efficacy? Get into Johnson & Johnson versus Moderna versus Pfizer, and which is best, or are they all equal?
Sure. So I understand why it's confusing, because if you look at the news reports, they say that the Pfizer and Moderna vaccines were 94, 95% effective, and the Johnson & Johnson vaccine was 66% effective. And that's a big difference. But the problem is you can't compare those numbers directly, because the Johnson & Johnson vaccine was not only studied in the United States, where it was 72% effective, but it was also studied in Brazil and South Africa, where they have these 2 variants where the vaccines don't work quite as well. And so, for example, in South Africa, where over 90% of the infections were due to that troublesome variant, it's B1351, but don't worry, it's no quizzes on that. We'll just call it the South Africa variant, still 57% effective. But more importantly, 28 days after vaccination with Johnson & Johnson, even in South Africa, even in Brazil, there were no people who got the vaccine who ended up hospitalized or dead from COVID-19. So all three vaccines seem to be very effective against serious disease, hospitalization, and death. Given the challenges with supplies, my recommendation would be, unless you have a severe allergy to one of the components to the vaccine, take whichever vaccine you can get as soon as you can get it.
Cindy writes in, what happens if I miss my window for a second shot? She got Pfizer, got her first dose, and 42 days later, got a second dose. So what happens if you get that second dose beyond the recommended date in which you're supposed to get that second dose in your arm? Does that make you more susceptible to the coronavirus? What say you, Dr. Brewer?
So the short answer is, Cindy, probably not. So we have good data from the AstraZeneca studies, which is a different vaccine, but to show that a longer period of time between vaccines does not change the effectiveness of the vaccine. And what we know from other vaccines like hepatitis B and HPV vaccine, which are multiple dose vaccines, is extending the window a little bit is not a problem. So it is important, however, to get that second dose. There's also data to show that the 2 doses give you better protection than 1 dose if you haven't already had COVID-19. So even if you're late, do please go ahead and get that second dose.
But Dr. Brewer, it's true, once you get that first dose in, it's better than not having any doses, correct?
That is correct. So there are some data to suggest right now that after 1 dose, you get about 80% effectiveness. However, as I said, when we look in the laboratory at the immune responses, it's very clear and easy to show that the immune response after 2 doses is better than 1. So if you're getting the Pfizer or the Moderna vaccine, do try to get that second dose. That's important.
Dr. Brewer from UCLA Geffen School of Medicine, one of the best infectious disease docs that we have. Thank you so much. We're now going to go to the Deputy Director from the California Office of Emergency Services. That's Lori Nazura. She also serves as the co-chair of the state's vaccine task force. All right, Deputy Director, we're getting a lot of questions about 50 to 64-year-olds. So Deputy Director, you got your crystal ball. We're going to ask you eligibility for the vaccine if you're 50 to 64. Do you anticipate that soon? And I'm just going to be candid, and I want to see if you think I'm right or if you think I'm incorrect. One of the reasons why we have not, as a state, gone to 50 to 64 statewide is because we just don't have enough vaccine at this point. We talked about a fairly flat forecast over the next 3 weeks, 1.8 million and change vaccine doses from the feds. But in May, we'll most likely have more flexibility, as we're expecting. The federal government is telling us 4 million vaccines per week. So, Deputy Director, talk to us about that 50 to 64 age group and when you think they're going to be eligible.
Thank you, Senator McGuire. You are correct. So maybe you're the one that has the crystal ball, not me. That vaccine supply really is driving that. We know that there are over 6.25 million Californians who fall into the 65 plus category. And we've got another probably 11,000 that fit into the other categories. That's before we even added in, starting Monday, those with disabilities. We know we don't have enough vaccine supply to even vaccinate all of them within the next week or month. But you heard it, I heard it. Our president did say that he's going to encourage states starting May 1st to vaccinate everyone. And so that does indicate that there will be a drop in the age limitation that we have right now. Will we have enough vaccine supply to do that? Hard to say. But I know that it is actively being discussed right now to drop the age limit. We have some counties that have already done so. They've already vaccinated 85% or more of their 65 plus population. So they feel comfortable moving on. As a state, we have to, of course, work on under statewide averages, and we're just not there yet as a state to pull that trigger. But in the next month, definitely too, we will undoubtedly see that age limit come down.
Again, all based off of supply. That's the Deputy Director and also co-chair of California's COVID-19 Vaccine Task Force. All right, Deputy Director Nazura, let's talk about TPA. We're getting a lot of emails about what does the TPA, what does it stand for? What is Blue Shield's role? So let's do a 60-second or less. So again, what we need to do as a state, and by the way, California is the size of many nations, 40 million folks, right? Incredibly complicated, large communities, a lot of open space in our neck of the woods, trying to be able to reach out to isolated communities. Blue Shield has been hired to be able to manage vaccine distribution on behalf of the state of California. They're working with every one of our 58 counties to be able to help develop individualized vaccine distribution plans, especially in rural parts of the North Coast. Counties can apply to get mobile vaccination vans, for example, and be able to go out into isolated communities. But the TPA is essentially Blue Shield. Blue Shield's role is to manage all the distribution of vaccines on behalf of the state. Deputy Director, I want to make sure that we're clarifying that, and please push back on me. The floor is yours.
You are correct. And I'm glad that you mentioned it the way you did. You understand. From my comments, I talked about the importance of creating a network. What is Blue Shield? Blue Shield is a network. So what we're doing by bringing them in as a third-party administrator is we're capitalizing off of their network and their ability to bring disparate groups together under the same umbrella. So it's their strength, and we're utilizing their strength to now consolidate and coordinate all of California's efforts so that we're all moving in the same direction with the same goals and nobody gets left behind.
All right, that's the Deputy Director for the California Office of Emergency Services, Lori Nazura. We're gonna go back to Dr. Brewer, one of the top infectious disease doctors in the United States. This comes in from Ann. Ann says, my concern, Dr. Brewer, is in regards to the Center for Disease Control new guidelines that, quote, fully vaccinated individuals can visit with other people who are fully vaccinated, quote, indoors. However, the current Moderna and Pfizer vaccines don't protect us from new viral strains. Talk to us about that, Dr. Brewer, and the concern that Ann has, and let's just be honest, millions of folks have across the state.
So Ann, you're exactly right, and it's a very important question. So what we do know is there are emerging data to suggest that the vaccines do prevent against asymptomatic infection and may is the critical word here, prevent against infection and transmission. But we don't actually know that. But the CDC is allowing fully vaccinated people, remember 2 weeks out from your last dose, to get together on the assumption that even if there is transmission there will be no serious disease, hospitalizations, or deaths. But ideally, what we'd like is a vaccine that not only prevents disease, but a vaccine that prevents infection. We may have that, but we don't have those data yet to know for sure.
All right, that's Dr. Brewer from UCLA Geffen School of Medicine. We're gonna stick with Dr. Brewer in regards to this is now coming in from Graham. Graham is 69 years old, lives in Humboldt County, severely allergic to PEG, which you're going to need to explain to us. It's an ingredient in both the Pfizer and Moderna vaccines. I'm anxious to get the Johnson & Johnson vaccine, but it doesn't seem to be available anywhere in the Bay Area. Talk about that and that concern, and tell us about PEG, Dr. Brewer.
So PEG is polyethylene glycol, which is one of the stabilizers in the two mRNA-based vaccines. So the problem with messenger RNA is it's very unstable. And so you have to add something to it to keep it from falling apart and keep the body from destroying it as soon as you put in. And polyethylene glycol is one of the stabilizers that both of those manufacturers use. Now, we know that the risk of severe allergic reaction to either the Pfizer or Moderna vaccine is on the order of 2.5 to 5 per million doses. So it is very low. However, if you know you have an allergy to polyethylene glycol, like Graham does, then you should talk to your healthcare provider about whether or not it makes more sense to get the Johnson & Johnson vaccine. Remember, that was just approved at the end of February, so it's going to take a while for production and distribution to get out, and the deputy director may have a better sense of when that vaccine will be available than I do.
So, Deputy Director Nazura, let's go to you. Johnson & Johnson, the federal government, look, just being candid, Johnson & Johnson has had some significant challenges with manufacturing. President Biden is now teamed up Merck with Johnson & Johnson, and Merck is now going to develop 100 million doses on behalf of Johnson & Johnson. But we're only expecting to receive here in California over the next 3 weeks about 44,000 doses. That should arrive next week, and nothing for the 2 subsequent weeks. So talk to us about Johnson & Johnson, Deputy Director Nazura, and where you think that will be in the coming weeks.
So we actually have received more Johnson & Johnson in the state. We had a bump this week because remember, we're getting federal allocations that are coming in above the state allocations. So even in the Bay Area at Oakland Coliseum, right now we're doing Pfizer's second doses, but starting on April 1st, I think, we're going to be going to new first doses with Johnson & Johnson. There are other programs that have also gotten Johnson & Johnson. So we are seeing it coming into the state. And like Dr. Brewer said, it's a viable vaccine. It's efficacious for keeping folks from going to the hospital or perishing from the disease. So, and it has the advantage of being 1 dose. So we'll probably see this utilized. We utilize it right now in our mobile units because they go out into the community, and then this means that they don't have to come back again. So I think that we'll see more and more Johnson & Johnson flow into the state.
That's Laura Nazura, the Deputy Director of the California Office of Emergency Services. We're going to now go to Ann, and it's spelled A-Y-N, so I don't mean to mispronounce your name, Miss Plant, but let's say Miss Plant, that's her last name. We're going to give the scenario of Miss Plant because it's one that so many are thinking, Dr. Brewer. Here's what Miss Plant says. My daughter is pregnant. She's not gotten the vaccine yet. She's 32. We're in a bubble with her and her husband. When will it be safe for her to host other people fully vaccinated in her home, yet she is not vaccinated? Do they all need to wear masks? Talk to us how that scenario works. How do you match up a room full of guests who are vaccinated with individuals who are not?
So Ms. Plant, the key there is anyone in the household at high risk for serious disease? So what do we know about COVID-19 and pregnancy? We do know that pregnant women are more at risk for hospitalization and death if they become infected with COVID-19 than similar age women who are not pregnant. It's not substantially higher. It's on the order of about 1.7 or so or 2, but there is some increased risk there. So the better part of valor would probably be for those fully vaccinated people to still wear their masks when they come to visit with your daughter. Now, the second question related to that is whether or not your daughter should be vaccinated. And that's something she should talk about with her obstetrician gynecologist, because if she gets infected with COVID-19 and it is spreading in the community, she is at higher risk for hospitalization and serious disease. As I said, these vaccines cannot cause disease. And while we did not study them in pregnant women, that was an exclusion criteria for the trials that were done, as far as we know, these vaccines are safe in pregnant women. And so your daughter should be having a conversation with her obstetrician gynecologist as to whether or not she should be vaccinated, particularly given now that the state is allowing people with high-risk conditions over the age of 16 to be vaccinated.
And there's some differing opinions out there, Dr. Brewer, for pregnant women. World Health Organization has expressed some concern. Others are saying there shouldn't be any concern. What's your thought on pregnant women receiving the vaccine?
So theoretically, there's no reason why these vaccines should cause any risk to pregnant women. They cannot replicate. They cannot cause disease. That having been said, we don't have a lot of data on their use in pregnant women. That's why the best step forward at this point would be to have a conversation with your obstetrician gynecologist. And that way you can sit down and you can weigh the risks and benefits of whether or not you should be vaccinated, particularly given how much spread of COVID-19 is going on in your community, and get all your questions answered. So that's what I would recommend for pregnant women. Go ahead, Senator.
I apologize, Dr. Brewer. Thank you so much. Did not mean to step on your toe there. One last question for Dr. Brewer, then we're going to go to the Deputy Director. Dr. Brewer, a lot of questions coming in right now about kids and being vaccinated. Parents don't want to send their students back to school because they can't get vaccines. The students can't, the kids can't. So number one, how do you feel about kids going back to school? A lot of studies have shown, and please push back on me, Dr. Brewer, but those kids, if masking and social distancing are relatively safe, obviously there's nothing 100% in a pandemic, but talk to us about kids and vaccines and what you hear about when those trials will be over, who are doing vaccine trials, and when do you think kids will start seeing the ability to get these vaccines?
So I'm not aware of any trials being done in anyone under the age of 12. So there are trials going on 12 and above, but under the age of 12, if they're happening, I'm just not aware of that. That having been said, we now have a number of observational studies, large-scale studies from France, from the United Kingdom, and the United States to suggest that there's very low risk for transmission of SARS-CoV-2 virus in schools, particularly elementary schools, if people are doing proper masking, hand hygiene, cleaning of surfaces, and physical distancing. And in fact, there are data that were just released in the past week from a study looking at Massachusetts schools to suggest that being 3 feet apart is as effective as being 6 feet apart. And so we're waiting to see if the CDC will change their physical distancing recommendations for schools. So at this point, schools, particularly elementary schools, do not seem to be important sources of transmission for COVID-19 in the community. And so putting in your plans like you have to do for the Department of Public Health should allow students to get back into schools, which will be much better for them than having not been able to go to schools, and do so safely.
We have over 3,000 folks now joining us for our critical town hall tonight, focus on slowing the spread with the special focus on vaccine distribution in Northern California. We welcome you. If you'd like to submit your question, your comment, your concern, your criticism, please email us. We want to hear from you. Senator.mcguire@senate.ca.gov. Email your questions, your comments right now, senator.mcguire@senate.ca.gov. We're now going to go to the co-chair of the state's vaccine task force. That's Lori Nazura. Deputy Director Nazura, we're going to go to Rosemary. Rosemary says, is the state of California going to adhere to President Biden's goal of opening up vaccines to everybody by May 1st?
Well, Rosemary, thank you for your question. And that requires me to pull out my crystal ball again. All I'll say is that, we're the state of California, and we're a nation state. We have to consider our population. Assuming that vaccine supply is plentiful at that time, I don't see any issue with us opening it up, as President Biden said.
Next question is coming in from Sandy. Sandy is a 73-year-old woman who lives in Marin. Her husband is 61 years old. She has her vaccine. Her husband does not. Deputy Director Nazura, we're getting a lot of questions about this, right? One spouse is older, one spouse is younger, one spouse has already got their first shot or second shot, the other is not eligible. Do you see that changing in the coming weeks?
As vaccines, that'll probably change. The husband who is under the age limit, perhaps he meets other criteria. Because that's expanded greatly, including, if he's the primary caregiver of the 73 aged individual, then he would be eligible today. So, I'd say look at all the options and see if you can get vaccinated. And otherwise, it won't be much longer before things open up, before that age limit drops, before we're vaccinating everyone.
As Deputy Director Lori Nazura from the California Office of Emergency Services, we got another question coming in. This one is from Miss Claus John in regards to residents with disabilities. Ms. Claus John asks, the public health guidance from the California Department of Public Health states that people with developmental or other severe high-risk disabilities are eligible for vaccinations effective March 15th. Can the Deputy Director please share the types of activities which are being organized to accommodate these community members to be successfully vaccinated? So talk about that. If a son or daughter has severe autism, how does that work to be able to get them vaccinated, for example? And how are you working with those family members from the disabled community in California? Deputy Director.
So most individuals will end up being vaccinated through their healthcare providers. There's also your local pharmacies. I would encourage you to look and see if they're vaccinating. And then the county, if you go to your county public health website, see where they're offering clinics. And if you need assistance, there are programs for free transportation if you don't have it, including paratransit. So if you need accessible transportation. So I would say call 211 in your area to see if that's available. Hopefully, with those options, you can find a way to get your vaccine. And as I mentioned, the TPA is working on developing a program in concert with county public health to take the vaccine into people's homes, to have these mobile units that go door to door.
Thank you so much. That is the co-chair of California's COVID-19 Vaccine Task Force. That's Deputy Director also for the California Office of Emergency Services. She wears multiple hats, Lori Nazura. We're going to go back to Dr. Brewer. Dr. Brewer is an infectious disease physician. He practices medicine at UCLA. All right, Ruben writes in, Dr. Brewer, Ruben is a soccer coach. He's a soccer coach at a high school. He's going to be fully vaccinated on March 24th. Coach Ruben wants to know, should he be worried of possibly infecting my wife and kids who aren't vaccinated if he is among kids, probably parents, who aren't vaccinated? So, Dr. Brewer, what should Coach Ruben do?
So Ruben, a couple of things. One is presumably most of your soccer activities are occurring outdoors. And we do know that outdoor transmission is much less common than indoor transmission. So it has to do with proximity, time together, mitigating factors such as indoors versus outdoors, and whether or not you're wearing your mask. So you're out in public, you probably should be still wearing your mask. if you're maintaining your distance and you're outdoors, your risk of acquiring SARS-CoV-2 virus from any of your athletes is extremely low. And you probably don't need to wear your mask when you're home. In fact, go out and say you don't have to do that, but do wash your hands when you get home and do wear your mask when you're out in public.
All right, Dr. Brewer, we're going to hang with you because there are a lot of questions about when the hell we are going to be done with this pandemic, right? So let's talk about that for a second. There's this thing called herd immunity. A lot of folks are asking, when are we going to get back to normal? So Dr. Brewer, get real with us. When do you think we're going to get back to normal? What is the percentage of the population that needs to be immunized to be able to get back to normal? And are we going to be wearing our masks at the end of this year?
So let's break that down into pieces. So let's start with the definition, herd immunity. So what herd immunity is you have enough people in a population who are immune or protected against a disease that when an infectious person comes into the population, there are no or not enough susceptible people to be able to transmit the disease to and allow it to spread. For SARS-CoV-2, models suggest that that's somewhere between 70 and 90% of the population needs to have that immunity. You can get that immunity one of two ways. One is to actually have the disease. The other is to be vaccinated. Clearly, vaccinated is the way to go. And that's why we're pushing so hard to do that. Right now, it looks like from models, we're going to probably hit that level somewhere in June or July if we are able to ramp up the vaccinations like the president says that we're aiming for. Places that have been particularly hard hit by the virus, like Los Angeles County, may actually hit that level a little sooner. However, this is a little bit like 9/11. We're never going to go back to totally what we were before, right? So we're 2 decades after 9/11. We still take our shoes off in the airport. So likely we're going to still be doing some things either after we get around that herd immunity, like wearing our masks sometimes in public, staying home when we're sick, even as things get better.
So Dr. Brewer, do you think it's realistic that July of 2022 that we may still be wearing our masks?
So I think by July of 2022, we're probably not all wearing our masks all the time, but hopefully even in July of 2022, we're still remembering to stay home when we're sick. We're still remembering to do a good job washing our hands. And if we're around somebody who is sick, for example, we're having to take care of a family member who's sick, then yes, probably we are wearing a mask in that situation. So some of these things that we've learned how to do, we're going to need to continue to do going forward.
Ladies and gentlemen, we are taking your questions. We have about 10 more minutes left. So we're going to do our rocket round of questions. This is where we're going to ask Dr. Brewer, Deputy Director Nazura, for 30-second answers to the questions that you're sending in. If you'd like to be able to get your questions answered, hit us up at senator.mcguire@senate.ca.gov. Use this email address right now. We want to hear from you, senator.mcguire@senate.ca.gov. We so appreciate you tuning in. Over 3,000 folks have stuck with us for the evening, and we're grateful. All right, Dr. Brewer, here we go. Let's get into our rocket round. Once fully vaccinated, is it safe to eat inside of a restaurant or go to a movie without a mask?
So wear your mask going to the restaurant or the movie theater. Keep your mask on in the movie theater. You can take it off while you're eating in the restaurant. Remember, they're only going to be at 25% capacity right now.
If, Dr. Brewer, if I only get one Pfizer shot and 42 days have gone by, do I need to start over?
No, but go get your second shot.
So when would you tell someone to start over for us in regards to getting a second, if they can't get their second shot?
So if you can't get your second shot at all, I think then the question is how much protection do you have? But even if it's been 2 months, 3 months, still go get your second shot if your first shot was either Moderna or Pfizer.
All right, next question, Dr. Brewer. We're doing our rocket round right now. Does Dr. Brewer not believe that we're ever going to get to the point where the virus dies out for lack of susceptible people passing it around?
So I think we're probably stuck with this SARS coronavirus transmitting, just like we have flu viruses transmit every year, but we will get back to a much more normal existence. So we will get back to a normal existence, but the SARS coronavirus probably will continue to spread just like flu viruses spread every year.
This next question is coming in from Bo. Bo asks, for individuals who've only received one dose due to a mild allergic reaction to a vaccine, can they get a Johnson & Johnson to bolster their immunity? Dr. Brewer.
So Bo, we have no data on mixing vaccines. The best thing to do if someone's had a mild allergic reaction is to talk with their healthcare provider about the risks and benefits of getting that second shot, because mild allergic reactions are relatively common. Severe allergic reactions are relatively rare. As I said, 2 to 5 per million, but that's a good discussion to have with your healthcare provider.
If you had a patient who got Pfizer, had an allergic reaction, and and then could get a Johnson & Johnson, would you recommend them getting a Johnson & Johnson mixed with that Pfizer, Dr. Brewer?
It would depend on what the allergic reaction was. So if they had a mild rash, then I would say, no, let's just go ahead and get the second Pfizer, and let's do it in a controlled situation where I'm going to watch you for at least 30 minutes to make sure that you don't have any problems, because 80–90% of people who have reactions, they're going to occur in that 30-minute period. However, if you had lip swelling, if you had trouble breathing, then I'm not going to give you a second dose of Pfizer, and we can talk about whether or not it's worth getting a Johnson & Johnson vaccine.
Dr. Brewer, UCLA School of Medicine. We're now going to go to the co-chair of the state's vaccine task force. We're doing our rocket round right now, getting as many questions answered as possible. All right, top question of the night, Deputy Director Nazura. I'm 64 years old. I'm 52 years old. When am I eligible? I know you've said it before, say it again. When do you think we're going to see eligibility for that 50 to 64-year-old age group?
We're already talking about lowering the age limit. Some counties have already done it. We have to look statewide at how many 65 and above we have vaccinated, but I think we're within about a month of seeing the age limit drop.
We're going to go back to Dr. Brewer. Thank you so much, Lori Nazura. Dr. Brewer, if everyone around me has been vaccinated, but I have not, do I still have to wear a mask around them? We're getting a ton of questions about that, Dr. Brewer. So say it again, please.
So if they're coming to visit you in your house, you don't have to wear a mask, and they don't have to wear a mask as long as you don't have any conditions that put you at high risk for serious disease. However, if you're going out and going to other people's houses, then yes, you should still wear your mask.
All right, we're going to go to Deputy Director Nazura. All right, Deputy Director Nazura, you're going to say it again. Based on the 1.8 million, this is from Mark, 1.8 million allocated doses for several weeks, when do you predict we're going to get 50 to 64? Again, please push back on me. State is anticipating, we're preparing, we're getting ready to expand vaccine distribution in Crescent City to Los Angeles. Until we hit that 4 million vaccinations per week, I don't want to put words in your mouth. We expect that to happen in May. We probably won't hit that 50 to 64-year-old age bracket until we have enough vaccines, at least statewide. Deputy Director, I'll give you the final word on that.
No, I think you're correct. It's all vaccine supply, and we do have the infrastructure in place right now to do 3 million per week. We're working on getting up to 4 million per week. As soon as that vaccine supply meets it, we will put our goalposts further out, and we will look to vaccinate more than 4 million per week.
Thank you so much. That's the co-chair of the state's vaccine task force, Dr. Brewer. Betty is COVID positive. Her appointment for a vaccine is on Monday. Can she still get the vaccine?
Yes, Betty, as long as you're not symptomatic. So if you're still having symptoms from your COVID vaccine, talk with your healthcare provider and postpone your vaccination till you're all better. However, if you're all better, definitely go ahead and keep your appointment.
This is coming in from Rick, Dr. Brewer. Rick asks, my best friend is having a baby in a few weeks. When will I be able to hold the baby? We're only one shot in already, and we won't be fully vaccinated until April 21st. Now, that baby is coming in the next few weeks. Should the person hold off until they get that second vaccine to hold the baby?
So, Rick, we are recommending that, yes, until 2 weeks after your second dose. And at that point, if you're visiting in the household, you can not only hold the baby, but you can do so without wearing a mask. But do wait until you're 2 weeks after your second dose. All
right. We're going to go to the Deputy Director of the California Office of Emergency Services. This is coming in from Eleanor. Is California now getting as much vaccine as we have capacity to distribute? Lori, is
capacity to do 3 million per week right now. We're getting less than that. So we continue pushing that goalpost out so that we can be ready when that vaccine does come in at the rate that we can utilize it.
We're going over to Dr. Brewer. Thank you so much, Lori Nazura. We're doing our rocket round of questions. Ellen asks, Dr. Brewer, can you please present stats, reports, etc., on the possible side effects of the 3 vaccines?
So, Ellen, the main common side effects are pain at the site of injection, muscle aches and fatigue for about 12 to 24 hours, and sometimes a low-grade fever. Almost all of these occur within the first 2 to 5 days and usually go away within 24 hours. We don't really have data yet for the Johnson & Johnson vaccine except from the trials. And from the trials, the side effects were very similar. We are seeing with Pfizer and Moderna a small number of people who've had a rash at the injection site that's lasted up to 1 to 2 weeks, but again resolves without any specific treatment.
Why do some people get flu reactions, vomit, are knocked on their fanny for 2 days after the vaccine, and some just get a sore arm? Talk about that, Dr. Brewer, because we see a wide range of impacts after the shot.
So probably related to how your immune system is reacting to the vaccine. Remember, the job of a vaccine is to stimulate an immune response. And the job of the immune system is to clear things out of the body that shouldn't be there. And so the more vigorous that response, the more symptoms you're going to have. So essentially, you're simulating what happens in an infection, but there's no infection there. It's just generating parts of a virus that the body's immune system is reacting to, but the body doesn't know it's just a piece of virus rather than an entire virus itself. That's why it feels like a flu reaction.
We're sticking with Dr. Brewer. He is moving quick through the rocket round of questions. We're going to go to Jeannie. Jeannie says, I got my vaccine, Dr. Brewer, and she's very thankful. What's next? Can you please ask Dr. Brewer, can I spend the holidays with the younger non-vaccinated members of my family? Again, a lot of questions about this, Dr. Brewer.
So yes, Jeannie, if they're in one household, you can go visit them. And as long as there's no one who's at high risk for serious disease, you do not have to wear a mask. However, if anyone in the household is potentially at risk for serious COVID-19, you should wear your mask. If you're going to visit people in multiple households, you still need to wear your mask. And if you want to go out to the restaurant, wear your mask to the restaurant. You can take it off while you're eating.
We're going to go to Deputy Director Nazura. Jason writes in, what is the state doing to communicate about vaccines to the Latino community? Deputy Director Nazura.
Great question. We have the Vaccinate All 58 campaign. It's available in English and Spanish with 6 more languages coming. We have toolkits. We have public announcements. We have YouTube videos and all in English and Spanish. We've got key leaders in the Latinx community who have sponsored some of these videos, and we would highly recommend that folks utilize those, share them with their friends and family in the Latinx community.
That's Deputy Director Lori Nazura. All right, we're going to go 2 last questions for each. We're going to go to Dr. Brewer. Dr. Brewer, Judith writes in, how long after being fully vaccinated should I continue to wear a mask? So we're getting a lot of questions about getting vaccinated, fully vaccinated, and wearing your mask. Dr. Brewer, after you're fully vaccinated, you go to Target, you're on an airplane, you're still going to have to wear your mask. Talk to us about it.
Correct, Senator. So even if you're fully vaccinated, you have to wear your mask, maintain that physical distancing when you're out in public, going to Target, the supermarket, or anywhere else. If you're going to visit your family in their house, no one with high risk for serious disease, then you don't have to wear your mask while you're in that house. However, if you're going to visit multiple people in a congregate setting, you still need to wear your mask, maintain your physical distancing.
Deputy Director Nazura, second to last question for you. Joshua asks, curious on clarity of vaccination distribution going forward. Is there going to be a significant change with the state taking a bigger role versus counties leading the effort? So Blue Shield's going to take over. We all need to think of Blue Shield as the logistics manager. They're going to handle distribution. They're going to work with the counties, and they're working with the counties right now to be able to get the vaccine plans, the expanded vaccine plans submitted to the state by March. So after March, vaccine plans are approved by the state. What is Blue Shield's role going forward? Deputy Director Nazura.
Blue Shield will be managing the vaccine allocation. They will be also managing the data collection and the data transparency. They will be working with local health jurisdictions, but they will be freeing the health jurisdictions from certain decisions and responsibilities and letting them focus on what they do best, and that is they know their communities. So they can work on programs that will get vaccinations to the homes of the homebound, that will get mobile units into the most underserved communities. They can do that with the resources that the TPA can bring to bear.
All right, that's Deputy Director Nazura. Let's go to our last question for Dr. Brewer, and then we're going to ask for closing comments. Again, thank you all for tuning in tonight for our coronavirus town hall focused on vaccine distribution. This is coming in from Michael. Michael says, what do we know about how the vaccines work against the variants? It seems like even vaccinated folks are going to expose themselves to the increasingly common variants. Does this mean, Dr. Brewer, that we're facing a series of waves that will make the vaccine less effective? Also, can vaccinated persons carry the variant and contract it? Dr. Brewer.
So, Michael, let's start with the last part first. So we don't actually know if vaccinated people can get infected and transmit the virus. So we're still trying to understand that. Some data to suggest that the vaccines may prevent that, but we still don't know that for certain. In terms of the variants, remember, variants occur because the virus is replicating and transmitting. That's why it's so critically important we continue to wear our masks, physical distance, stay home when we're sick, when we're doing all of that. What we know from studies of the Johnson & Johnson vaccine is even the variants we're most concerned about in Brazil and South Africa, after 28 days, that vaccine, nobody who got vaccinated was hospitalized, had serious disease, or died even from a variant. However, when we look in the laboratory, we do see that the South Africa, the Brazil, and maybe the California variants are not quite as susceptible to the vaccine as the UK variant. That having been said, the level of protection is still enough probably to prevent serious disease, hospitalization, or death. So please do get your vaccine.
All right, a popular question that I missed. I lied to you. There is one more question, Dr. Brewer. Sue writes a question that's very common tonight. should I get tested once I've been vaccinated? Dr. Brewer.
No, Sue, we're not testing people after they've been vaccinated.
All right, that's the final word from Dr. Brewer. We're going to turn it over to Deputy Director Nazura for closing comments, and then we'll hear from Dr. Brewer about any advice he has going forward. Deputy Director Nazura, closing comments, please, 30 seconds.
Thank you, Senator, for this time. And folks, I hope through this information, you're able to get the information you need to get you or your family members vaccinated at the appropriate time, that you are confident in the vaccine, and that you are continuing to have those healthy habits like washing your hands and physical distancing and wearing your mask out in public. I'd also want to point everyone to VA58 at cdph.ca.gov for some fact sheets and posters and videos that you can share with your community to pass that same information along.
That's the Deputy Director for the California Office of Emergency Services, Lori Nazura. She also wears another hat as the co-chair of the state's COVID-19 Vaccine Task Force. Deputy Director Nazura, again, I can't say thank you enough. You have been incredible to work with through fires, through floods, and now this pandemic. We are grateful for your service. Thank you for joining us. Dr. Brewer, final word, sir. The floor is yours.
So first, I want to thank everybody for the tremendous sacrifice that they've done through this whole 1 year long pandemic. I realize how challenging and difficult it's been. These vaccines are very safe. If you have any concerns about the vaccines, please reach out to your healthcare providers and have a discussion, because you're going to want to be vaccinated as soon as you're eligible. And remember, all 3 vaccines have been shown to be highly effective against serious disease, hospitalization, and death. So don't worry too much about which vaccine you get. And if you have any concerns, please talk with your healthcare provider.
One of the best infectious disease physicians that we have in the state and throughout the nation. That's Dr. Brewer from UCLA Medicine. Dr. Brewer, thank you. Thank you for being that voice. As I said earlier, that voice of reason all throughout this pandemic for Northern California. We are grateful. And we also got to hear Dr. Brewer's dogs here tonight as well. So Dr. Brewer promised us that. And I wish my pug was here because she would be yipping at my heels as well, Dr. Brewer. So thank you so much. We love you, Dr. Brewer. You do a fantastic job. Just to be able to close out here this evening, again, I'm a big believer of under promise, over deliver. And for the first time since the start of this pandemic, I can finally say that there is truly light at the end of the tunnel. And we got to remain vigilant. We got to remain vigilant to ensure that that light continues to burn bright. We are working diligently each and every day with counties up and down the North Coast to be able to expand vaccine distribution. We're preparing for the federal government to expand our weekly allocation to 4 million vaccination doses per week. That won't happen, though, most likely until May and into June. So we are going to be working here with counties to be able to ensure that their vaccination expansion plans are submitted to the state of California by the end of March. So by the time we see that increased allocation of doses, we're ready to get shots into arms. And I want to end it as I started it with some good news. About half of all Californians, and who would have thought this during the holidays, about half of all Californians age 65 and up have received at least 1 dose of vaccine. Over the last 48-hour period in California, it was the highest ratio for shots into arms since distribution started. About 1 million doses were allocated over the last 48 hours. And in the past 2-week period, we put 3 million doses of vaccine into arms here in the Golden State. Look, we can't be satisfied. We have to do better. And tonight, we can promise you that we will. Hope is just around the corner. And we're grateful that you have joined us tonight. We're grateful that you have joined us for our 17 other coronavirus town halls since last March. I promise you, we're going to be working hard to be able to get the vaccine network up and running in big cities and in rural regions all throughout Northern California. Until next time, stay strong, Northern California. Thanks so much for joining us.